Hey, you are watching AliAziz YouTube channel.
Top 16 Substance Abuse Counselor Interview Questions for Fresh and Experienced Candidates. 1. What is the role of substance abuse counselor? The primary role of substance abuse counselor is to help that patient who is addicted to drugs and advise them in fighting addiction. 2. Explain what are the duties of a substance abuse counselor. Duties of a substance abuse counselor includes organizing interview with potential patients, advertising periodic drug tests, conducting counseling sessions, reviewing records to assess his patient treatment, recording treatment and progress details, enhancing treatment plans according to individual requirement, developing aftercare programs, taking follow-ups. 3. What do you mean by comprehensive continuous integrated system of care, CCISC? It is a theoretical method for bringing the mental health and substance abuse treatment system under single integrated planning process. 4. In addition to substance abuse treatment by counselor, what another service they might require? The other services they might require other than treatment by counselor includes detoxification, screening and assessment, treatment for psychological and mental disorder, treatment for physical health issues, legal assistance, case management, vocational skill development, and employment, family-oriented services like reunification, child care, and visitation. 5. What are the main challenges that substance abuser faces? Main challenges they face are trouble managing negative emotions, lacking problem-solving skills, hampered moral reasoning, cognitive distortions. 6. Mention what are the behavioral treatment does counselor use for substance abuse. The behavioral treatment that counselor use to treat substance abuser includes behavioral therapy. In this therapy, patient is taught how to avoid a situation where they are more prone to abuse drugs by positive reinforcement, modifications in feeling like anger and pain, breathing and relaxation methods, social skill training, etc. Multidimensional family therapy. In this therapy, patient's family help is taken to support patient to recover from drug addiction by various means like discussion with family members, motivating patient, participating with patient in drug abuse programs, etc. Motivational interviewing, motivating patient to change their behavior and enter treatment, motivational incentives. Positive reinforcement of patient from drugs. 7. What counselors are expected when treating a patient who is aggressive? Counselors must do things like, rather than focusing on patient's weakness, emphasize on its strength, join rather than assault, resistance, avert aggressive discussion and power struggles, focus on the patient's personal responsibility for change. 8. Mention what are the psychological signs of drug abuse. Unusual mood swing, lack of motivation, seems fearful for no reason, paranoid thinking, poor memory, abnormal changes in personality and attitude, anxiety and unexplained hyperactivity. 9. What all areas does substance abuse counselor works? They work in various sectors like detox centers, halfway houses, nursing and family services, hospitals, individual and family services, substance abuse centers. 10. How do counselor monitor the progress of treatment? Counselor monitors the progress of treatment by analyzing data of results of urine tests, checking patient attendance record at scheduled sessions and rehabilitation programs, by rating the patient improvement towards achieving treatment goal, patient self-rating of progress toward achieving treatment goals. 11. Explain what slip is and relapse in substance abuse patient. Slip: when a substance abuser is on a rehabilitation program and after a long period of abstinence suddenly pick up alcohol or drugs and stops again right away is referred as slip. Slip is avoidable as it is just for that moment and patient can return back to its treatment. Relapse: it is more serious for the substance abuser compared to slip, as the patient goes back to the same situation. The patient starts consuming drugs or alcohol in full flood and stops attending rehabilitation programs. 12. How counselor treat patient falls to slip or relapse. For first and second slip, counselor formulates its abstinence program that help them to enhance their decision-making, problem-solving, and behavioral skills. Further, they can also extend their stay in rehabilitation program by 2 to 4 weeks. For third slip, patient will be transferred to a stabilization group. In here, patient will go under intense care program for 2 weeks, and once achieves complete abstinence, he can return to his early treatment program in the case of relapse. The counselor can alter its counseling schedule and induce individual counseling for a maximum of 4 weeks. Apart from that, they can also recommend the patient for regular urine testing and attending clinic, followed by in-house treatment. 13. How a counselor deals with crises or in the event of emergencies. In the event of emergencies or crisis, counselor can confront patient through 24-hour telephone answering service. Further, they can implement supportive interventions to stabilize the crisis and stop relapse and dropout. The patient is also provided with frequent individual counseling sessions until he is stabilized. 14. What are the major factors that pull patient to relapse situation? Major factors that are responsible for pulling patient to relapse are affective negative feelings. Exposure to drugs or alcohol is often an attempt to control the feeling like shame, loneliness, guilt, other negative thoughts. And the likelihood to any of this feeling can push the patient towards relapse state coping mechanism. Patient who lacks skills necessary to divert himself from substance abuse can go back to relapse opportunity and availability of the drugs. Availability of abuse substance can persuade the patient for reconsumption of drugs and take them to relapse stage. Drugs and alcohol should be kept out of sight of the patient. Attitude, mental strength, and positive attitude of the patient play important role to stop him from substance abuse. A positive environment can prevent the patient to fall back in the mind frame of substance abuse. 15. Mention what is the difference between substance abuse treatment program and substance abuse treatment system. System abuse treatment program. It is an array of services and interventions that deals with substance abuse disorder in patient and provide them both ongoing treatment and acute stabilization. System abuse treatment system. It also treat a patient with substance abuse disorder, but it has a broad array of services. 16. Mention how relapse prevention therapy can be categorized. Relapse prevention therapy, RPT, can be categorized into assessment procedures, awareness raising techniques, coping skill training, cognitive strategies, lifestyle modifications.